McKinsey wrote an article, Ready, Set, Go, Reinventing the Organization for Speed in the Post-COVID-19 Era. And this is one of the things I wanted to focus in on. Speed and agility. We have to get faster. And how do we get faster? We have to look at how do we deploy talent? How do we redeploy talent? How fast do we launch new business models? How good are we at improving productivity over time, incrementally or more broadly? How fast are we developing new products, shifting operations? Clearly, McKinsey wrote this article not specifically for healthcare, but for businesses in general. And what they are saying is COVID has changed everything. It didn't really change everything. We were already here. It just made it obvious to everyone else. There's a need for speed, and we're not turning back. And so they go into reinventing the organization for speed, rethinking the ways we work, reimagining the structure, reshaping the talent, who we hire, how we deploy them, where we put them. We need to speed up and delegate decision-making. So decision-making can be made faster with people who have the information, who are more in contact with where the decisions will do the most good. We need to get them the information, give them the right structure to speed up decision-making. Step up execution excellence. And they go on to say, just because the times are fraught does not mean that leaders need to tighten control and micromanage execution. Rather, the opposite. Because conditions are so difficult, frontline employees need to take on more responsibility for execution, action, and collaboration. And I want to echo that is great words to live by. A lot of times when we get into these things, we think, I know what to do, but no one else knows what to do. Therefore, I'm going to bring more control in. Worst thing you could possibly do. And Stanley McChrystal had a great story of how they were so far behind in battling the Taliban and others because they had distributed control and command and control type of decision-making, and everything for the U.S. was centralized. And it wasn't until they distributed that command and control that they started to make the decision-making. I keep saying command and control, the decision-making, that they were able to thwart and actually make progress in that battle. Cultivate extraordinary partnerships. Working with partners is routine, but the speed of action only goes so far if other players in the ecosystem fail to move just as fast. Okay, and I think the other thing is cultivate extraordinary partnerships at scale and at speed. One of the things we did when I was a CIO is we looked at, hey, we need to bring in all these potential partners, but we set them up for a legal process that takes 3 to 6 months to get through the gauntlet. And so what we created was a short, repeatable contract for new partners where they could get into a sandbox, work with not even de-identified data, just fake data, and prove out their systems. And so that contract was really easy to get signed, really easy to get people up and running. They were working on our systems with fake data so that they can prove out that their solutions worked. And then over time, we could then move them into more structured contracts. Because if their stuff didn't work, there's no reason to go through the big contract anyway. And if their stuff did work, then it would take them some time to prove it out. We would get to see that, and we could get the true contract to get to de-identified data and then potentially live data. Flatten the structure, unleash nimble, empowered teams. The pandemic has seen a large-scale deployment of fast, agile teams, small, focused, cross-functional teams working together towards a common set of objectives. This is make hybrid work, field tomorrow's leaders today, learn how to learn. These are all great concepts. This is a really well done article. I say this to say we need to do this in healthcare. This is how we need to be thinking. We need to be thinking agility is the most important attribute I think we're going to ascribe to a health system moving forward. The story is Ready, Set, Go, Reinventing the Organization for Speed in a Post-COVID-19 Era. If you get the chance, hit the McKinsey site, download that, read it, share it with your team. It is a great conversation piece for your team to go through.